As most of you know, I'm the current president of AAPI. I also am a psychiatrist practicing for past 30 years in Pittsburgh, Pennsylvania. So for my term as the president of AAPI, I felt I should focus a lot on the mental health across the globe, the population's health. And in this connection, we have been promoting the awareness of mental health, both here as well as in India. So we were planning this Global Healthcare Summit for a few months ahead of time, as well as in the past year, when we could not have the summit in 2020 due to the pandemic. And when I was visiting India for planning, I met with our Honorable Chief Minister of Andhra Pradesh to get some ideas and support from their team. And he rightfully suggested we focus on the mental health of the high school students and in their early part of their lives. Because if they are not receiving the proper education as well as the health care, especially the mental health care, screening and health, that will not only affect their careers, it will affect their entire life as well as livelihoods of their themselves, their families, their economies, their societies. So he rightfully suggested that we do something about it, and he gave some ideas and connected with a variety of leaders and administrators of his government, Andhra Pradesh, our government of Andhra Pradesh. Do you want to share the screen, Aparna, so we'll go through some of the information that kind of emphasizes the salient points why we are here today. So that is the initiation given by our Honorable Chief Minister of Andhra Pradesh, Mr. Jagannath Reddy Garu. So we gathered a team of psychiatrists, both here in USA as well as in India, as well as many other mental health related professionals and counselors. And a lot has been done over the last few months, to especially due to the dedicated work of Aparna and her team, and also the team back in India. So now coming to the last few months, we were in Visakhapatnam for Global Healthcare Summit in January 6 to 8, and it was I'm very pleased to report to you, it was a grand success. It was attended by over 500 to 600 people at a time, and well received and well acknowledged for its emphasis and its impact. And again, we had a meeting with the Health Minister of Andhra Pradesh, Mrs. Rajani Viradala, and her team of administrators and officers. So we released this program called EASE, Emotional Assessment of Students by Educators and Referral in Andhra Pradesh. Primarily, we're starting with Andhra Pradesh because of the contacts we have there and the emphasis the government is putting there for mental health, the high school students and medical students. So our team today consists of myself, Aparna Upala, child psychiatrist from Huntsville, Alabama, Mr. Nelson Vinod Moses from Bangalore, and Mr. Medapati Venkat, part of the government of Andhra Pradesh, and of course my good friend Dr. Vasudev Reddy, who is also involved with the AAPI as well as the government of Andhra Pradesh through being the NRI advisor, which is the cabinet ranking position. And so we'll give you a little bit of background about what it is. 2021 State of World Children Health Report says 1 in 7 youths, especially in India between the ages of 15 and 24, reported feeling depressed. So that's a significant number, almost 15% of the population of that age group. And also WHO notes that there are very few psychiatrists, 1.3 psychiatrists per 7,000 population versus and 1.12 nurses and 0.7 psychologists and 0.7 health workers for 100,000 population, 1 lakh population, which is starkly limited resources that we have there. So only 47 mental health hospitals are in the country. At least 1 student dies by suicide every hour, and about 28 deaths per day in India. So that's a staggering number and alarming number. In 2021, there were 1,64,000 suicides were reported in the country, highest rate of deaths in India since 1967. And the highest number of suicides in the world, showing an increase of 7.2% compared to 2020 per national crime records. and 10,730 deaths of children below 18 years and young accounted for 67% of the total suicide. And also these numbers are also questionable because a lot of deaths that are certified as suicide are probably not capturing the entire number, because in India, the police report that determines one committed suicide or not. It's not the coroner's report or a pathologist report. So this is a pioneering effort. We are reaching out to various sources and resources to help us to create a foundation like this program to launch and implement and impact the outcomes in a positive way. So we'll hear more about it, the more background and more structure of what it can be, what it should be, how we can plan to launch and plan to conduct and bring some value and make an impact. So please listen to the rest of the presentation and give us your feedback and support, and would like to make it an important aspect of this year's AAPI events and activities. Thank you so much.
Thank you, Ravi Garu. I'm so grateful for this opportunity. Namaste, everyone. The objectives that we have is prevention, intervention, and postvention. So it's promoting the emotional well-being of all children. We're talking about kindergarten till 18 and beyond, actually, too, raising awareness in all levels, in the schools, in the homes, in wherever we can find collaborators and assess mental health of students by the teachers. We are training the teachers like that, and then referring the identified students who need help in the schools and promote research to gain insights. So it's a collaborative project. Government of Andhra Pradesh, the Department of Health, Department of Medical and Family Welfare, Department of School Education, including Department of Intermediate Education, Department of Medical Education, including APSCRT and School Health and Wellness Program. It took a while for me to learn all the names, with the initials and all that. And as you know, AAPI is a main collaborator, and we are having so much of support, and it's wonderful that Dr. Ravi Kohli is a psychiatrist. Mental health has been long ignored, and we now have focus on mental health. So the first step that we have is to train what we call master trainers. So we have the school education component and the district education, the lecturers, they have different terms for all of these. But basically, we will be training 152 of these master trainers in English with the QPR Pro Gatekeeper training, which is 4 hours of virtual self-paced training. And then we have Mental Health 101 and Emotional First Aid, 4 hours online with instructor. That SPIF is going to do it, the Suicide Prevention India Foundation. And it's in collaboration with APSCRT with IECHO. And then the instructor training is 12 hours in-person workshop. So we'll do it in Visakhapatnam and Vijayawada and Tirupati, so that all the areas are covered. And these 152 master trainers will go to these places and get that. And they will get a combined credit of 20 hours of training and joint certificates. Total cost is below. And I will tell you about the training cost at the end as well. And the virtual platform will be provided by IECHO, and AAPI physicians will plan the content and dates for CME. So that is the thing. So how it works, how this program works is there'll be an ease checklist for all the students after parental consent. The teachers, after they get their training, will identify any troubled youth by the criteria that we set. So teachers will identify them and refer them for telecounseling. They will upload the checklist and document the concerns and the referral and document outcome with follow-up, provide support and accommodations to students, keep confidentiality will be stressed at all times. And then they will be referred to the Telemanas or the Jeevana helpline. Telemanas Tier 1 is the district mental health teams, the adolescent counselors, they can refer, and then the Telemanas counselors will be there. The UNICEF website and mobile app will be using that as well. So they'll have the ease assessment template. All of these counselors will have that. We have NIMHANS guidelines for telecounseling that we will be strictly following. there'll be virtual counseling, in-person counseling, depending upon where the location is. And these counselors will refer to the pediatricians or the primary healthcare physicians at the adolescent-friendly health clinics if they need the help, and they're going to refer to the psychiatrist if more help is needed. So the telemedicine tier 2 is telemedicine, and it's the doctors, it's the MBBS doctors at the adolescent-friendly health clinics and the pediatricians. And research, we are thinking about research and grants as well. So the goal is zero suicide. Yes, it is a very, very ambitious goal. And to date, this is one of my most ambitious projects. But together, I think we can do that, So I look forward to all your support in whichever way possible. And if you have any questions, I will be able to answer them at the end. But I'm going to go ahead and give the floor to Nelson.
Thank you, Dr. Aparna. Thank you, Dr. Ravi Kohli. Thank you, Dr. Vasudev Reddy, and welcome, Venkat Garu. And thank you, everybody, for attending today and hearing us out about the EASE project. Dr. Ravi Kohli was talking about the number of suicides in the country. We have more than one student suicide every hour in the country. And this is according to the National Crime Records Bureau. This number might be double that. So we're talking about 2 student suicides every hour in the country. So before we finish this presentation today, we will have 2 students die by suicide. And for every suicide, there are 25 attempts. So we're talking about 50 suicide attempts. And we're talking about at least for every suicide, there are 100 students having suicidal ideation. So we're talking about 200 students with suicidal ideation suffering from that. Not to mention that every suicide attempt or every completed suicide leaves behind. Think about India as a large country. We've just overtaken China in terms of the population. And that's why these numbers are, we're talking about saying there's more than one student suicide every hour. But here are the details. For the age group 15 to 29, globally, suicide is the second leading cause of death. In India, it is the leading cause of death. For 15 to 39, it is the third leading cause of death, suicide is. And in India, it is the leading cause of death. So our young people, during COVID from 2019 to 2020, the increase in the number of student suicides was 21%. So we have we have a public health crisis on our hands, and it requires a public health response from everyone. Having said that, let me just introduce Suicide Prevention India Foundation. We are a not-for-profit company, and we were incubated at IIM Bangalore, one of India's leading management institutes, and we have an exclusive partnership with the Institute, the world leader in suicide prevention training. So quickly, what do? We do research on suicidality. We train gatekeepers. That is a World Health Organization recommended suicide prevention strategy. In fact, the National Suicide Prevention Strategy, which was just launched in December 2022, also recommends suicide, gatekeeper training, suicide prevention gatekeeper training. So we also create awareness through, content, and we have tie-ups with the likes of Meta globally, Instagram, Wikipedia, and YouTube. So we try and create awareness about the fact that this is an issue. And we also talk about saying what can each person do and how they can do it. And we are hoping to also start advocacy with governments and civil society to address suicide as a public health concern. We have been working with the government of Karnataka and NIMHANS on a project called Hosa Belugu. In Kannada, it means a new light. And over there, we are looking at training the medical fraternity because according to a piece of research, the biggest return on investment for suicide prevention programs is training, because in 90% of suicides, the person will visit a general physician 6 to 9 months before they die. So we're going to be training doctors, nurses, and also community health workers. We received support from the government and NIMHANS for this program. We are hoping to launch this soon. So the population will include teachers. It will include the first-year medical students, because the rate of suicide among medical students is pretty high. And I mentioned the West Bengal government mandating gatekeeper training for all medical colleges, the first state in the country to do so. Doctors as well as mental health professionals, because according to a USA Today study, in the US, 70% of all mental health professionals do not get any training in suicide prevention. So in a country like India, we're talking about upwards of 95%. So mental health professionals will not have the training to help somebody out in case they're going to be suicidal. Even if they come to them and say that, hey, I am suicidal, can you help me out? They may not know what to do. So this training is going to be critical to make sure that after the refer happens, the Q and the P and the R, the refer part, that mental health professionals and the doctors are equipped to handle somebody who comes to them who's suicidal. NIMHANS will train mental health professionals. We spoke about the CBT therapy, a very simple, simple and effective, therapy to manage anything related to, from emotional distress to managing suicidality. I think a lot of you have heard of something called the starfish parable, where there's a young girl on the beach and she sees all the starfish lying around the beach, and she takes one and she starts to put it. And then, people looking around are saying, well, there are, hundreds of them on the beach. Are you going to save all of them? And you're not making any difference. And then, she looks distraught and then she says, hey, but, I made a difference to this starfish. So for everybody here, we're talking about, just a contribution of $10 or $25 or $50. And then we're going to have hundreds of girls on that beach saving lives. And this can make a huge difference. This is going to be India's first pioneering initiative taken up by the Andhra Pradesh government, but we hope that this becomes a model that gets followed by other states. We have the most suicides globally. We can turn that around. China had the most suicides globally. And then they introduced a suicide prevention strategy and a policy, and they've reduced suicides considerably. We have an opportunity to do so. And we also have a mandate according to, the Sustainable Development Goals. We are a signatory to that. By 2030, we're supposed to reduce suicides by 30%. We are nowhere close to that. So we have about 7 years, and we should get started, and we should get started now. Thank you so much for listening.
Venkat Garu is the AP NRTS Society President. He has reached out to us knowing about the EASE project, and he's going to be our next speaker. Venkat Garu, you can go ahead.
Happy Mahashivratri to all. And thanks Aparna Garu, thanks Ravi Garu, thanks Vasu for having me here today. I just want to quickly say what APNRTS is and also tell you about the services we provide. APNRTS is AP Non-Resident Telugu Society. That's a government organization, works under the government, and actually governing body chairman is Honorable CM Y.S. Jagannath Reddy Garu. And we basically provide, I head up the organization, and we provide services to NRIs, the Telugu NRIs from AP all around the world. So any type of services they require out of state government. So about 2.5 weeks ago, the Commissioner of Secondary Board Education, the Intermediate Education, has come to us, said, since we've been talking about this for the last 3-4 months, he said, the exams are coming very soon. They're going to be in the next 3-4 weeks, the final exams for intermediate students. What can we do to help them to ease their stress? The life skills, stress management, time management, in these aspects, if you guys can help us, since you've been saying that there are NRI doctors who are really, capable, talented, well-experienced in the Western countries, and if they can be part of this and they can help our students and lecturers here, it'll be of quite use. And then, I quickly talked to Vasu, Dr. Vasu. I call Dr. Vasu because we've been very close. We've been, working on different things for the last 10-12 years. And then he immediately connected me to Aparna Garu and then Nelson. And, Nelson Garu was quite accommodative and quite helpful from the day one, that, you can see his enthusiasm working on this particular cause. And Aparna Garu being the expert in this area, and she readily agreed. And we said, okay, since we cannot do this entire program within this short time, how can we come up with a miniature version kind of thing? And that's what they worked on in about 3-4 days. And they created this handbook and created the presentation, which takes the lecturers and then eventually students through the stress management, time management, and providing them with all sorts of tips and how to manage during this next 4 weeks time before final exams to do a better preparation and have better results out of their exams kind of thing. So to do this program, we had to quickly talk to the intermediate board and saying, because we have a short time and this is like a 2-hour session every day, and how many days can we, handle this and complete as much as possible in terms of reaching out to most students kind of thing. So we kind of came up with a plan saying pick up 1 or 2 lecturers from each college, whether it's government or a private college. And then they came up with about 6,800 lecturers. And we need to accommodate all those 6,800 lecturers in the period that we have, because their practicals are starting, exams in intermediate are starting about, a week to 10 days from now. After that, they have only a few more days left, and then their final exam starts mid-March. So our plan was to, train as much as possible with the stress management and time management skills to the lecturers, 1 or 2 lecturers from each college. So in turn, they give that same presentation to their students within their college. And that way, we percolate this down to the students, probably to at least 4 or 5 lakhs of students kind of thing over the next 3 weeks, so that, they can follow these steps. They can, the breathing exercises that were put into that and the scenarios that were presented by Aparna Garu and Nelson Garu. And, students can relate to themselves with these scenarios and, follow all the tips that are, being given to them, including the breathing exercises and meditation concepts. And that way, they can ease their stress and they can become better learners and preparers so that they can do their best in their final exams. So basically, this 2-hour program, we are doing every day, including a film actress come social activist, Jhansi Garu, who is also being part of this. She also readily agreed. She is joining every day in this program. So basically, it's been divided into 2 districts each day. In Andhra Pradesh, we have 26 districts, combined few more into each session kind of thing. And now it is open to access for thousands of lecturers, because it's mostly Aparna Garu and Nelson Garu is presenting for 2 hours, and they can be in a listen mode and they can observe all this, and then the presentation will be provided to them, and the handbook is provided to them both in English and Telugu, so that they can pass it on to the students kind of thing. And every day, hundreds of lecturers are joining this program, and we have completed this first week's program this week. And the rest of the lecturers are going to, for the remaining districts in Andhra Pradesh, they will be learning all these tricks. And then, I shouldn't be saying tricks, the very important subject wherein all sorts of good information is being given to them. The next week, the remaining lecturers will have their part. And then over the next 2 weeks' time, the target is set to all these lecturers to, again, present all this material to their students within their colleges, so that we will be able to accomplish. So I am really thankful to Aparna Garu, Nelson Garu, Ravi Garu behind this whole effort, and then Vasu Garu. And I appreciate AAPI for doing all the great work and providing all sorts of services on the medical front to different states within India and AP too. And I look forward to working with many of you in the coming days and weeks and months.
Thank you, Venkat Garu. Short of time, so Vasudev Reddy Garu, go ahead, please.
Good. Thank you so much, everybody, and happy Mahasivaratri to each and everyone. And I really thank you for joining this. I don't want to take more time to go on repeating what previous speaker said. And this is a great program. And our Honorable Chief Minister, Sri Y.S. Jagannath Reddy Garu, has been dreaming of improving quality education, healthcare, and mental health in the state of Andhra Pradesh. I'm really humbled and grateful that I met our brother, Dr. Ravi Kolli Garu and Dr. Aparna Garu. When I talked to her initially, she was kind of hesitant. After that, she did amazing job, Aparna Garu. I really thank you for your time and effort for serving the motherland, and also Mr. Nelson and Venkat Garu for coming up and supporting on this project. And also, let me briefly, I don't want to take much time, and let me briefly say what we have been doing behind the screens. We have been reaching out to NGOs. Apart from AAPI, it's a great help, Rotary Club, Lions Club, UNICEF, and World Health, WHO, and UNICEF, and other corporate sponsors. I really request, my humble request to each and every one of you to spread the word, reach out to your friends, and reach out to any corporate companies. Every corporate company has a fund, social responsibility. They can support, you can get them involved. Who can name them as ambassador, like a EASE program sponsored and supported by so-and-so, who can have their name and company logo on the program. So this is, like I said, a great program. We have to work on this and, to help students, primary healthcare teachers and psychiatrists in the state of Andhra Pradesh to improve mental health. We always believe in working together. I always believe in, Sabka Saath, Sabka Vikas, working together, we can achieve this. To improve education, healthcare, building 17 new medical colleges in the state of Andhra Pradesh, primary health centers, telemedicine, reaching out to international donors to support all initiatives in health, education and healthcare. My humble request to each and every one of you, spread the word, please make them involved, support on EASE program. I really thank you. Thank you so much for joining in this program. Thank you, Dr. Ravi Kolli Garu, Aparna Garu, Nelson, and Venkat Garu for supporting this program.
All of you heard the passionate plea for all of you to partner for this very important, very impactful project. And there are a lot of loose ends to be tied for this program to be successful. We need your blessings. We need your support. We'll connect all of you to the platforms where you can donate, not only here through dollars. So we'll have a button in our AAPI website after we create a memorandum of understanding or a statement of intent from the agencies that are involved. And also, AAPI has a AAPI India Foundation just started, and it is able to receive rupees and donations in India through Indian sponsors. And like my brother Vasudev, interesting, Sadhguru Vasudev and our Guru Vasudev are all on the same page here today. And so you can ask your friends and your families and your corporate benefactors to support AAPI India Foundation for this dedicated program. And the funds will be sequestered for this event only. So there will be 100% transparency as far as launching in one state. We have resources and connections and ability to connect with one state now, but it's not limited. We want to partner with any state, but alumni leaders can take lead and connect us with the political and structure in each state, so we can continuously develop this program across the state. We have Nelson from Bangalore working with us. We have everybody, whoever is interested, we want to help them to implement these programs in their home states, hometowns, home cities, so we can all work together on this noble cause. Thank you very much for all of your participation, and we'll send you a newsletter or website links for you to be able to contribute your valuable resources and your advice. Thank you again.